Given the COVID-19 situation, repeatedly we get a question, are the masks really helpful? Well, there is a new evidence that suggests that novel coronavirus might be able to spread through the air. It also seems to be contagious enough that people don't have symptoms to show they are infected. Those two worrisome findings led the US Centers for Disease Control and Prevention to recommend everyone to wear masks over their noses and mouths in public. With the medical-grade mask in short supplies, CDC recommends that these be reserved for healthcare workers who probably need it more than you do. The public was advised to look for cloth mask, which could be DIY, do-it-yourself, make-at-home mask. The best guard against airborne viruses are known as N95 mask. These are what hospital workers sometimes use around people who are sick. They are different from the masks that doctors and nurses wear in surgery. With N95 mask in short supply, the medical community has been asking the public to reserve their use of hospital teams and for first responders. But despite that recommendation, people have been buying N95 off eBay, Amazon, and other sources. But the question is, can a normal fabric mask help someone? Well, if a sick person wears one of these, the mask may catch most of their germy droplets or spit and nasal mucus. That could limit the virus from getting onto surfaces that others might touch. But these masks are designed to protect people from mask wearer, not the other way around. So the question is, how well do cloth masks work, if they work at all? Without masks, people sick with new coronavirus can likely spread germs even without coughing or sneezing. Just breathing can send some viruses into the air, and data show that fabric masks might capture some of that. While the size of a typical cloth mask, the perforations of a size in the mask would be at a level of few nanometers, and the coronavirus is known to be around 5 nanometers, so it can pass, but there are good likelihood that it will be able to stop it. An international research group led by a team of University of Hong Kong studied 246 people sick with the viral infections. Some had coronaviruses, which cause a common cold. Others had rhinoviruses, which also cause a different kind of a common cold, or influenza viruses. A few were infected by at least 2 different types of viruses. The researchers randomly assigned half of the people to wear a surgical mask. Then the team measured viruses present in each person's exhaled breaths. Between 30 and 40% of the people with coronavirus infections exhaled viruses if they wore no mask, but no virus was detected in breaths exhaled through a surgical mask. Those masks appeared just a bit less protective for people with the flu, and the mask made no difference in how much virus was exhaled by people with rhinovirus infections. Those findings are important, but may not say how well cloth masks will work. The reason surgical masks are made from a non-woven material, it's different from the cotton and the other fabrics used in cloth mask. A cloth mask must filter out small particles, but still be easy to breathe through. Some materials, such as vacuum cleaner bags, filter well, but make breathing difficult. Cotton t-shirts are a far more breathable fabric, and in this study, they filtered microbes roughly half as well as surgical masks. Another advantage of wearing such masks, they reminded wearers that they should not be touching their nose or mouth. For people interested in sewing their own masks, Online University has, created their own DIY guides, and you can refer to YouTube description in this video to follow those guides. Cloth masks don't fit properly around the face. There will be gaps on the sides. Many people who also don't wear them properly, such as leaving their noses exposed while covering their mouth. That's why it is recommended that if you put on a DIY mask, you should be properly covering any gaps that may occur around nose and your face. Studies of surgical masks have demonstrated that they can block the large particles that fly straight out in front of the mouth. But small virus-laced droplets and other airborne particles can still shoot out to the sides and top of surgical masks as well. With cloth masks, some viruses may shoot through as well as around the sides and top. Another limit of all mask studies, no one has shown how many coronaviruses particles are needed to start an infection. Is it 1? Is it 2? Is it 100? We don't know yet. So if you are able to reduce the number using any kind of a mask, it's a good start. For certain viruses, few as one virus may be enough. But even if the cloth mask filter out only 10% of the virus particles, in a pandemic, maybe it's worth doing it. Any contribution that we can do towards decreasing the impact is a significant step forward. A mask of any sort will help capture some virus-laden droplets before they can enter the air. They also reduce the forward force of exhaled cloud of droplets, diverting flow and cutting the turbulence. That should limit how far the particles can travel. But a mask does not replace social distancing. That comes from researchers at Massachusetts Institute of Technology in Cambridge. They also say that it is not high-grade protection that people should feel overconfident about.